Okay. Hello, everyone. This is the first episode of Ryan on Rounds. So, the idea behind this is for those things of information to talk about that really don't quite fit for a video, per se. The idea is more of like conversation type things. And in the future, I may have people actually join on the podcast, but for this, I figured I would do a monoscript for now, and we just kind of see where things go from there. This first one is kind of a heavy topic, but it was actually brought to my attention by a few different individuals now that I should make something like this because this is something that I experience myself. So I thought it would be an interesting take for something that's, to my knowledge, has never really been talked about at all. So, this is called the quiet minority. And it's not exactly what people think of when they think of veterinary medicine, but it is actually men in veterinary medicine. There's a version of veterinary medicine that people see, and usually boils down to, say, compassion, teamwork, support, calling a clinic all the coworkers that you have in a clinic as family. And then there's a version that some of us live in, and that's what I like to call the quiet minority. Men in the field over the years have kind of dwindled. It has become excruciatingly heavily women-based. And there's nothing wrong with that, to a degree, I would say. There's nothing wrong with women themselves, but I do think that it would be beneficial to have more of a balance, per se. The overwhelming majority of men that are in the field are veterinarians themselves. So you have an even smaller group of those who are not veterinarians, who either have chosen nursing and or have stayed for one reason or another. And these individuals have learned quickly that being a minority doesn't always come with a conversation. Sometimes it comes with silence. And that's more of the type of stuff I wanted to kind of go over today. Now, let's talk about something uncomfortable, because we'll just get it kind of out of the way. Bias, I would say, against men does exist in veterinary medicine. It's not loud, it's not policy level, but it is cultural. And it shows up in small ways. You're introduced as, like, say, our big guy, or our muscle, instead of by credentials. Or you're handed every aggressive or big patient that's in the clinic because you're bigger, you're physically stronger, you're naturally stronger. I mean, men are known to have about 30% more muscle mass than women, so yes, you're naturally stronger. And you're told, can you lift this, before you're even asked, can you do something else, like run anesthesia? Your medical skill becomes secondary to your physical utility. And if you speak up about it, for many individuals, you get told, be grateful you're needed. I'm very blessed that I don't have to experience that firsthand. At the veterinary offices that I've been in, and some of the schools that I've been at for shadowing, I've never had to experience that, nor have I ever seen that firsthand, but there are definitely instances that has occurred globally for different veterinarians, different veterinary staff that are male. There is an unspoken rule that is kind of not even brought up a whole lot among those that are men in the field by themselves. And that is, men are expected to absorb more, per se. Kind of going back to what was stated originally, more physical risk, more emotional restraint, more workload without complaint. You're expected to get these things done and do them and not have any form of repercussion behavior or have any form of problems from it. And it's kind of, like I was saying, a cultural aspect. Let's say, for instance, if a female colleague cries after euthanasia, she would get support. Her coworkers would come up to her and console her, and she should receive those things. Any individual who is saddened or experiencing something should be consoled. But often what winds up happening is if a male colleague cries, the room goes quiet. You'll even hear the phrasing from some individuals that if a man cries in front of them, that they themselves they don't know how to respond to it. It's not hostile, it's more of like an uncomfortable problem for the individuals that are around, especially for the individual, the man that's experiencing those things. So you kind of learn not to express your emotions per se. Is that healthy? Not at all. It's not healthy. You need to be able to express your emotions. But for many individuals, they feel as though they can't, or that they shouldn't, because of one thing or another, or some cultural thing that's occurring in the office. You kind of wind up learning to process grief in the treatment room while you're restocking syringes or you're taking vitals on the next patient for a procedure or something else. So I'm kind of going down like a list of bullet points here, so I may pause every second here and there to just kind of collect my thoughts as we're going over this. Now, being one of the only men in a clinic means you're often not part of the cliques, or even the clique by itself. We all have experienced this either one way or another, say in high school or middle school, or some form of social gathering. Even in families, there's cliques. It's for a man in a veterinary clinic, you're oftentimes not part of the group chat. You're not part of the after work vent sessions, not part of the emotional support network. You're not invited oftentimes to many of the outgoing events or things. And sometimes when you are, you feel as though you can't. And I'll kind of get back to that point in just a second. But again, none of these things are not intentional, but culture forms around similarity. That's just a fact. And when you act as an outlier, you become professionally included and socially adjacent. You're in the room, but not always in the circle. And going back to the statement I made before, sometimes you feel as though you can't because of what you are. If, say, the girls at the clinic invited me to go to the movies with them, and it's just them, and then it would be me. Well, speaking as a straight man that would go and be with a bunch of straight girls at the time, I know that for many individuals that might be uncomfortable when their boyfriends or fiancés or husbands find out that there's a man hanging around when there's no other men hanging around. If there's at least like two to three men in the group, it helps kind of balance that situation out. It's an awkward cultural thing per se. Clients unintentionally will also kind of add to another layer of problems for a lot of men in the industry. Some immediately will trust you more. I find that I relate a lot more to men than many of my coworkers wind up doing. And I find that it's easier to kind of talk to women oftentimes. Female clients are usually much more prone to discuss things with you and listen to you. Men are usually much harder to discuss things with, but they often open up a lot faster with me than they do with the rest of the girls, and I can read their body language and tell that. It kind of creates tensions that you don't really ask for, and some will trust you less. Especially, there are female clients that will trust you less. That just seems to be the more of the common denominator. And there may have been something historical in that woman's life that made her feel that way, or something else that has occurred, and I can only hope the best for them. I sincerely hope that everything goes better for them, but you also didn't exactly ask for any form of tension there either. Either the strong one or the intimidating one, it's rarely just being the technician or the receptionist or anything else that your role comprises of in this field. And this is more geared towards those that are not wanting to be veterinarians. This is more of just that kind of barrier is legitimacy. You're constantly asked, so when are you applying to vet school? Now, granted, I am going to vet school. I know I will be going to vet school at some point. It's hard to get into vet school by itself, and I'm going to keep fighting all the way to get there. But there are some that are not interested in going to vet school. They don't want to go to vet school. They maybe want to be a technician. They want to be a licensed veterinary technician, and that's fine. You constantly get asked that as if staying a technician is a failure to progress. As if choosing nursing as a career is temporary by default. And men in tech roles are often seen as future veterinarians or short-term workers, or just the grunt, as I like to call it, the muscle. They're not seen as long-term medical professionals. It's that perception limits a lot, whether it's mentorship or leadership opportunities and identity within the field. And the thing that kind of meshes all men in the field together is the internal part. And that's usually the emotional toll that's brought about. You have compassion fatigue. It doesn't care about who you are, what you believe in. It will creep up on you, especially since we work hard hours. We work for oftentimes not the greatest pay. We are often faced with odds that are very capable of rendering you stuck in a situation for hours on end. Burnout, it will just add on top of that. And moral distress doesn't care about gender either. I mean, all of those things will add on to you just as much as a woman does. And that's the truth. But the thing that often winds up happening for men is the coping spaces often do. They do care. And men in veterinary medicine have some of the highest silent burnout rates. Not because they feel more, but because they express less. And that actually leads to a scary number of those individuals that unfortunately may take their own lives. You hold the patient during euthanasia, you carry the body, you clean the room, you go back to appointments. You don't get asked oftentimes how you're doing. And sometimes it comes with how you are as a man. You oftentimes will say, "I'm fine." And that statement by itself, in the way that a man expresses it, though it may sound excruciatingly similar to just me saying, "I'm fine," a male can tell the difference between "I'm fine" and "I'm fine." Women often have a harder time distinguishing against that unless they really, really know the individual. So they may ask you the first couple of times, and you may say that as pretty much like a way of just pushing forward and doing, quote, man things. And then they won't ask you anymore because you look like you handle it well. There's also deeper conflicts in that the profession is built on compassion. It's a trait society doesn't always encourage nowadays in men. So you exist in a space where defining strength is something you were never socially trained to display. You care deeply. You may love what you do. You may want to go above and beyond your job to do it. But you don't always have the permission to show it. It's frowned upon. Why? Why is something that you're compassionate about, things that you want to do more, things that you are fully capable of doing? You may even take time out of your own time off for things that you enjoy, just blatantly enjoy, to help or to do, and you're not allowed to do it. It's a very, very odd topic to kind of discuss, but for a lot of people, they don't seem to understand some of these problems. And speaking to some of these individuals that suggested that I talk about this were actually women, and these are women that eventually learned about these type of things. And some of them were like, "Is this true? Like, is this kind of what it's like?" And I'm like, "Yeah, that's basically what it's like." Unfortunately, this is almost what it's like for not just veterinary medicine, but really any form of occupation nowadays for a man. A lot of this can translate between occupations, especially in human medicine. So the conversation that I'm basically trying to have here is not saying men may have it harder. It's not at all. It's about saying men have it differently. Veterinary medicine has made incredible progress in supporting women, and that progress should continue. But true inclusion and true equality means recognizing every minority within the profession, even the quiet ones. So, what would help? Well, mentorship, for one, for men who want long-term careers as doing nursing duties, so being like a licensed veterinary technician or registered veterinary technician or whatever your state may have, is one suggestion. Something else you could probably do is recognition for men in such roles as medical professionals, not just physical resources. also provide like emotional support spaces that don't assume one communication style, and try to add a way where there's a uniform platform of language that introduces people not by their body type, but by who they are as a person. You know, if I go and introduce a female doctor by, this is Dr. Nicole Fine, I should also introduce the doctor, if it's a male that comes in, as Dr. Robert Gregory. You know, those are, you should treat each individual with the same equal respect. So if I have an LVT that comes in, I'll say, this is my LVT, named Sarah, and then this is my LVT named Jonathan. Those people are introduced equally. But most importantly, permission should be given for men to be compassionate out loud and not be silenced or act as, in a very blunt way of putting it, the muscle or the pack mule, or really anything in terms of what you can take advantage of for a man's strength or a man's ability to do something. If you want true equality to occur in a workplace for all of your staff, it needs to be an even playing field and equal assignment of roles, not just assigning to one or another because of their physical capabilities. And being a man in veterinary medicine often means caring more than the patient, saying less than you feel, and being seen for what you can lift instead of what you know. But we stay because the medicine matters, the patient matters, the team matters, even when we're not fully seen. We're not here to take space, we're here to belong in it.